Hi, I'm Marvin Plackett, and today is Monday, November 30th. Greetings to all residents, to all staff, and to all guests and friends worldwide. So I haven't seen you for a full week because I wasn't here on Thursday. It was Thanksgiving. I sure hope you had a rewarding, a rich Thanksgiving, and I sure hope that it was a safe Thanksgiving. So welcome back to Monday of a new week. We at this time have 10 active COVID cases. So that's a couple more than when I was last with you a week ago. We have 5 residents and 5 staff. And the residents, 3 are from Episcopal Church Home and 2 are from Kearney Heights. The ones that were from the Gardens, those have been resolved. Those residents have recovered. So again, 5 residents, 3 are from Episcopal Church Home, 2 are from Kearney Heights. 4 of the 5 are on our dedicated COVID unit at Episcopal Church Home at this time. 1 is at Kearney Heights. Just found out about that case this morning, so I'm not entirely sure what the immediate status is here this afternoon. But that's the latest information that we have. And the 5 staff, of course, they are at home recovering and will not be scheduled until they are fully resolved and recovered. Testing continues, of course. As we know, COVID is really surging dramatically around us. And so as a result, we are doing weekly testing at Episcopal Church Home and at the Gardens. And so we feel very fortunate that in light of this recent major surge that we have at this time 10 active cases. Obviously we wish there were 0, but we have 10, we don't have 50, we don't have 100 or 200. There are some communities like ours that are very unfortunate. They have very skyrocketing numbers. We don't, and we're very, very pleased about that. I'm going to read an excerpt from today's Star Tribune, lead article, Fauci warns of waves of surges. And you may have seen him on the news programs yesterday, on Sunday morning programs. Anthony Fauci likens the impending first wave of vaccinations to a light at the end of the tunnel. But the government's top infectious disease expert emphasized Sunday that these vaccines will not come soon enough to avert, quote, a surge upon a surge of new cases due to Thanksgiving gatherings and travel. In all likelihood, this devastating wave will continue to shatter records for infections, hospitalizations, and deaths. Quote, when you have the kind of infection that we have, it doesn't all of a sudden turn around like that, Fauci said on ABC News this week. Quote, we don't want to frighten people, but that's just the reality. So with Thanksgiving, of course, there's going to be a delay in the recording of additional cases. And then, of course, as we know, it isn't very far away, just 3.5 weeks, and we have Christmas. And then a week later, we have New Year's. And so with the surge that is occurring, not just in Minnesota, but in the surrounding states and throughout the U.S., we're likely to be in for at least a couple of more months of significant challenge. Because when COVID is out there in society, with the prevalence that exists at this time, it's always knocking at our door. And so remember the little things that we have to do right all the time because they make a huge difference. And that is wearing that face mask, staying at least 6 feet apart, frequent hand washing, and if you have any symptoms, self-isolate and get tested. Okay, those are crucial features at this time. And just as Dr. Fauci said, I'm not trying to scare you with the surge. It's just that this is the reality of where we're at right now. I was asked by a resident, thank you, Cherie. I was asked, get tested. I've said that repeatedly. Get tested where? Get tested how? So for our for those that live in our nursing homes, testing is occurring at least weekly already. In Iris Park Commons, our assisted living, testing gets completed on slightly less frequent basis. but testing is available, of course, at Iris Park Commons as well, our assisted living. But in our independent communities, which we have 7 of those, here are the ways that I suggest that you get tested if you feel you need to, all right? If you have any symptoms whatsoever, get tested. Here's how you can do it. Number 1, be in touch with your healthcare provider, okay? So your doctor might have you come into the clinic and get tested there at your regular clinic. Another way is to go to the website, to the Minnesota Department of Health website. And on that website, it's really easy. There's going to be a spot that's going to say COVID information. Click on that, and then you're going to quickly be directed to another link that's going to say testing sites. Or it's going to maybe say ways to get tested. And then one of those is going to be testing sites. So you can go to these free testing sites that exist around the Twin Cities, and in fact, they exist around the state of Minnesota. Another way is you can do in-house free testing. You can you can request the test kit through the Department of Health. Once again, go to the website, COVID information, and then how to get tested, and then where to get tested. And one of the options there is going to be free in-house testing. Now, here's the thing though, with that free in-house testing, you need to request it in advance because it takes, as I understand, a week or more to receive it in the mail. So if you have no symptoms right now, but you're planning ahead, just in case one day you get symptoms, now would be the time to order yourself a test kit, okay? And order it, and then once you actually have the test kit, and if you self-administer it, then as I understand it, the results come back from the lab pretty quickly. Okay, I've talked to somebody who's done this. So those are the ways, again, that you can get tested. 1 is be in touch with your healthcare provider and follow their instructions. Number 2, there are free testing sites around the state, around the Twin Cities. Just go to the Department of Health website and they will direct you to it. And then the 3rd way is free in-house testing where a kit is sent to your home. All right, so those are the ways. For those that are living in our independent communities, you cannot get your tests at our 2 skilled nursing facilities or at Iris Park Commons. Those test kits are for their residents and for their staff. All right? Okay, it's Monday. That means it's birthday announcement day. All right, so here's happy birthday to these people. Ellen Hooper at Episcopal Church Home, Geralda Stanton at the Terrace, Doris Utke at Cornelia House, Kim Guion at Seabury, Roberta LaPont at Midway Point. I'm sure I'm going to mess up some of these pronunciations. Sorry about that. Kai Tron at King's Crossing and Jean Baker at the Terrace. A very big happy birthday to all of you. All right? So everyone, take care. Be safe. Do all the little things right. Do it for your safety. Do it for your loved one's safety, your neighbor's safety. We're in this together. That means everybody needs to cooperate. So take care. Enjoy the sunshine. It's a beautiful day today. I look forward to seeing you on Thursday. Bye-bye.